Okay, y'all, if you're looking for a non-surgical way to decrease the signs of aging, have you ever considered injections?
I am so excited about this segment. Dr. Richard and Dana LeConey with the Institute of Anti-Aging, they are joining us once again. Welcome back to Houston Life with all the details, along with their patient Ellen Van London, who in just a few moments, Ellen will be getting a liquid facelift. I'll let you guys get the process started because I know it's a bit involved, but let's jump right into the process, because does this really work? I mean, how would someone see results with a liquid facelift compared to a surgical facelift?
Well, you know, obviously, it's still for folks who are kind of just at that early point of the changes in your aging. So these are things you can do. We call it basically anything you can do with a syringe.
Okay.
And
so you're basically just relaxing the muscles that are, you know, contracting, and then putting filler back where we've lost our volume.
Okay.
Just like this.
All right, so this is Botox, right?
This is Botox, and what we're going to do, Ellen, frown like you're really, really angry. See those little muscles? Now, she gets Botox pretty often, so it's not really dramatic, but we're going to soften that by injecting these muscles and relaxing them.
Okay.
So here we go.
And is there a numbing cream that's put on in advance?
We did.
Yes,
We sure did.
In the back.
But that's optional, right? Because you have patients who come in and they just want to be in and out.
They want to be
just
in
use
and
ice
out.
Or nothing at all.
Okay.
And Ellen, are you feeling anything at this point?
Nothing at all, just a little pressure.
Okay.
It's like a Texas mosquito bite.
Oh, yeah, state
There it
burn.
is.
We love that.
Texas mosquitoes.
Don't laugh. Don't be laughing.
Now, see the corners there, the crinkle. Okay, so when we do this, it'll relax that.
And so that's on the eye, right? Because normally we would think, or around the eye, I guess is what I'm saying.
Yeah, it's around. Yeah.
Okay.
And the muscles are surrounding the eye, but not the ocular muscles, but the little facial expression muscles.
And we do see a little blood spot there. I mean, that's normal, right? To just have like a tiny little bit of that. But is there any immediate redness, or could someone do this on their lunch break?
They absolutely can. She'll have bumps for about, 5 to 10 minutes, and then they go away.
Yeah, these little bumps right here that look like mosquito bites, they'll be gone in 30 minutes.
Okay.
Look at this. Look at her neck bands.
Okay, now, Ellen, say E. Now, this is called a platysmal band, and it's what we do is we just inject a little Botox right here.
So underneath the chin.
Underneath the chin. This is about the only thing we do below the chin. Say E again, and I'm going to grab that little band. And if y'all can see that.
One thing that's really interesting about these injections, Dr. LeConey and Dana, is that you're not necessarily injecting into the problem area. Our face is all connected, right? So sometimes an injection up here is actually affecting what's much lower, correct?
Right.
In a way, yes, exactly. Yeah. And the face, all the muscles are interrelated, so you have to account for that. And the way the muscles are interrelated.
And that accounting is why you really should go to someone who knows what they're doing.
Definitely. You need to know a little bit of the anatomy there.
Okay.
And we have to remember, too, that Botox, of course, takes a little bit to show the effects, right?
Yes, you'll start to see it relax in 2 to 3 days, and you'll get your maximum results in 14 days.
14 days. Yeah. And let's take a look. While Dr. LeConey is finishing the injections, we do have a before picture of beautiful Ellen and her lips, which, by the way, you have fantastic lips, but Ellen, you weren't too thrilled about them, I guess.
Oh, wow.
Look at that.
Oh, my goodness.
And that's with the filler.
And we just did them yesterday, so she's still a little swollen.
This is yesterday?
Yes.
Oh, my word.
Now, obviously, Ellen cannot speak right now because the needle is right in her lips.
I'm behind her.
Stop asking me questions. I'm kidding.
Sorry, I was behind. I couldn't see. Okay, stop laughing.
Well, okay, so unlike the Botox, which takes a couple days to sort of settle in, you can see the immediate result
it's
with the lips.
instant gratification, yeah. I mean, she has a little swelling for a couple days, but by this weekend, they're going to be beautiful.
And this was yesterday, this video we're seeing
yesterday.
now?
Yeah, that was yesterday.
And Dana, explain, because it looks like you're sort of going right along the border of her lip. Why is that?
We are, because that's where we tend to lose that shape. So if you go along the border, that's called the vermilion border, it just gives that sharp definition.
Oh my gosh.
And then if you look at that little triangle, the Cupid's bow is what we call it, that gives that pretty little point on the upper lip.
And Dr. LeConey, you're actually going on the chin now. Is that filler as well?
I'm filling this little deep crease that Ellen has right here, which has been bugging her. So what we're going to do is put a little filler right in that crease and smooth it out.
And again, even for people who may be a little bit wary of needles, it's remarkable to have a front row seat to this process. Ellen, thank you so much for letting us watch this, because she's not flinching at all. She doesn't seem to be in any discomfort.
Well, the needles are so tiny, so you really, I mean,
quit doing that. So.
Sorry.
The other thing that I think that we need to tell our viewers about is that you all like to practice on the natural side.
That's exactly
which
right.
I think is so important because
Right.
we've all seen
duck
the duck lips.
Yes.
Yeah.
Overdone.
Yeah, we don't like that look at all. So, yeah.
Less is more.
And
we have
hers are a
people
little
come to us
swollen
to
today,
fix
but
that.
they're going to go down, like I said, by this weekend.
Sure.
Your office, by the way, is beautiful. I've been to your office,
Thank
full
you.
disclosure.
We both have.
And it's beautiful. It
Right.
is. It's a space that people don't feel like they're walking into a doctor's office.
Right.
But if viewers want to come and see it for themselves, you guys have an open house coming up,
We
right?
do, October 3rd from 3 to 7, and we're going to have live demonstrations of this, cool sculpting, and a lot of other procedures. And yeah, we'll have refreshments, giveaways.
And
door
specials,
prizes.
too, that night?
Oh, a lot of great specials.
So you'll be doing the injections that night?
Oh, yeah.
Okay.
Yeah.
And okay, so on the screen right now, these are the specials that we're talking about, right? $10 a unit for Botox, $100 off fillers.
Well, that's just for this, today.
Oh, so people
Or for-
can get that anytime?
Yeah, that's for today, but we're going to have even better specials at the open house.
Even better than that.
Yeah.
Ooh, that's a good tease. Antiageinstitute.com. By the way, Courtney and I are going to be there that night.
We are.
gonna
Yes.
stop by.
We
So
are
Thank
definitely
you.
there.
Friends.
Yeah.
Awesome.
Your office is very inviting. We've
you.
gotten the tour, and it's really fantastic. We love it.
Good. Thank
You're
you.
such a good sport.
Oh, thank you.
Thank you
And
for
let's
coming
check back in because
know.
I didn't see really the full finished product. How are you feeling?
No pain at all.
No
Let's
pain at
have you
all.
look.
None at all.
You look great.
And you know what? Your lips were nice before, but I totally can see how they are fuller and they look great. So nice. It's amazing that it happens in just a matter
So
of
quick.
a couple
I
minutes.
know. Okay, to take advantage of these specials and for more information, once again, that number is 713-807-1000, or just log on to the antiageinstitute.com. Dr. LeConey, Dana, Ellen, thank you so much.
Thank
It's
you.
wonderful.
And we'll
Thank
see you at the
y'all.
open house, October 3rd.
October 3rd.
From 3 to 7. We'll be there.
Thank you.
All right, folks, still ahead on Houston Life. Did you know Houston is home to the largest pediatric cancer